Welcome to Whiteboard. Dengue has become a global problem since the Second World War and is common in more than 120 countries, mainly in Asia and South America. About 390 million people are infected a year and approximately 40,000 die. In 2019, a significant increase in the number of cases was seen. Dengue fever is a mosquito-borne viral infection caused by 4 dengue virus serotypes: Dengue 1, Dengue 2, Dengue 3, and Dengue 4. Infection with one serotype provides long-term immunity to the homologous serotype but not to the other serotypes, so you can be infected again. Secondary infections put people at greater risk for severe dengue fever and dengue shock syndrome. Typically, people infected with dengue virus are asymptomatic or have only mild symptoms such as an uncomplicated fever. Others have more severe illness, and in a small proportion it is life-threatening. Symptoms. Time between exposure and onset of symptoms ranges from 3 to 14 days, but most often it is 4 to 7 days. The characteristic symptoms of dengue are sudden onset fever, headache located behind the eyes, muscle and joint pains, and a rash. An alternative name for dengue, breakbone fever, comes from the associated muscle and joint pains. Symptoms can be mild or severe. Mild symptoms of dengue can be confused with other illnesses that cause fever, aches and pains, or a rash. The most common symptom of dengue is fever with any of the following: Any warning sign symptoms of dengue typically last 2 to 7 days. Most people will recover after about a week. Symptoms of severe dengue. Watch for signs and symptoms of severe dengue. Warning signs generally begin in the 24 to 48 hours after your fever has gone away. If you or a family member develops any of the following symptoms, immediately go to a local clinic or emergency room. Stomach or belly pain, tenderness, vomiting, bleeding from the nose or gums, vomiting blood, or blood in the stool, feeling tired, restless, or irritable. Now let's focus about the vector. Dengue is spread by several species of female mosquitoes of the Aedes type, named Aedes aegypti and Aedes albopictus. These vectors widely adapted to urban and suburban environments. Aedes mosquitoes are visually distinctive because they have noticeable black and white markings on their bodies and legs. Unlike most other mosquitoes, they are active and bite only during the daytime. The peak biting periods are early in the morning and in the evening before dusk, 6 to 10 a.m. and 3 to 6 p.m. Aedes mosquito lays eggs in stagnant water which can survive up to 1 year. The eggs can withstand dry conditions and hatch when water is available. Water storage tanks, flower pots and vases, garden fountains, bird baths, fridge trays, water dispenser trays, broken cisterns, discarded bottles, tins, discarded tires, coconut shells, etc. are all possible sites. Aedes aegypti is a so-called holometabolous insect. This means that the insect goes through a complete metamorphosis with an egg, larvae, pupae, and adult stage. It's called a life cycle. The life cycle of Aedes aegypti can be completed within 1.5 to 3 weeks. The adult lifespan can range from 2 weeks to a month depending on environmental conditions. Okay, now let's see how we can reduce the risk of dengue infection. There are 2 ways of prevention. First one is mosquito control, and second one is reduce mosquito bites. To control mosquitoes you can follow these steps. In mosquitoes' life cycle, 3 out of 4 occur in water, so the best way to reduce mosquitoes is to eliminate the breeding places, like artificial containers that hold water in and around the home. In urban areas, Aedes mosquitoes breed on water collections in artificial containers such as plastic cups, used tires, broken bottles, flower pots, etc. Periodic draining or removal of artificial containers is the most effective way of reducing the breeding places for mosquitoes. Larvicide treatment is another effective way to control the vector. For reducing the adult mosquito load, fogging with insecticide is effective. To reduce mosquito bites you can follow these steps. Wearing clothes that cover the body and minimizes exposure to mosquito bites. Mosquito repellents. Mosquito nets. Installing net screens on doors and windows. Although there is a commercially available vaccine against dengue, but prevention is still the most important step to reduce the risk of dengue infection. Let's keep our home and environment clean, and maintain it as zero breeding places. Thank you for watching. Like us on Facebook. Subscribe us on YouTube.